All right, 5 minutes after 9 o'clock, it's time for Veterans News. Today, Veterans News is a full hour long, and Gary Pascal and Joe Martone's guests today are Dr. Jose Torres and Dr. Howard Eskildsen. They'll be talking to you about your health, and we'll get to that in just a bit. First, good morning, Gary. Good morning again, Joe.
Good morning. Good morning, Larry, and good morning, listeners and veterans out there. It's good to be with you this morning. God bless each and every one of you. Hank's not here this week, but we do have some officer down. I didn't have any fire casualties, and I heard about a Department of Defense casualty on the radio this morning, but we don't have the official report on that, so we'll go ahead and get started with the police officers, and we have three of them this morning. We have Trooper Pilot Burke M.M. Bates, who was with the Virginia State Police. His end of watch was August 12th of 2017. And we have Lieutenant Pilot H.J. Cullen, also with the Virginia State Police. His end of watch was also August 12th, 2017. And we have Deputy Sheriff Jimmy Clark of the Quitman County Sheriff's Office in Missouri. His end of watch was August 13th of 2017. Our thoughts and our prayers go out to the families of these fallen officers. Larry?
Amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see.
Amen. Well, we want to thank the great folks here at WOCA for putting us on the air week after week. And Joe, we just appreciate you and we love you for doing that.
Hey.
And also the fine folks at Hires Baxley who sponsor us. Hires Baxley has had generations of family honor them with their trust and their confidence. And they believe it's because for the last 128 years, their team of caring professionals have established a reputation of serving families with excellence and compassion. Hires Baxley currently partners with the Boy Scouts of America, Troop Number 72, to properly dispose of decommissioned American flags. They're also a drop-off program location for cell phones for soldiers, helping to provide them minutes that matter and helping our heroes home. Hires Baxley is located at 910 East Silver Springs Boulevard in our own beautiful Ocala. And if you have any questions, you can contact them at area code 352-629-7171, or simply take your fingers and go to the web on your little computer, and you can get them very simply at Hires, HIERS Baxley, BAXLEY.com. And Joe, you got one that's been
Well, of
with us
course
for a
I
long
have
time
one.
there.
They've been with us for a while. It's Bob Wine's Community Gardens. Veterans News is brought to you by Bob Wine's Community Gardens and Nursery at 2610 Southeast 38th Street in lovely Ocala. You got me saying lovely Ocala. When it comes to landscaping, Bob Wines has what you need. Everything from small plants to large trees, mulch, fertilize, and so much more. Bob Wines will even deliver, plant, and guarantee their trees. Bob Wines Community Garden and Nursery has been keeping you blooming since 19 1952. And yes, they are a supporter of veterans, because if you are a veteran, you get 10% off with proper identification. That's Bob Wine's Camellia Gardens. Give them a call. 629-5766. That's 629-5766. Bob Wine's Camellia Gardens. Back to you, Gary.
Joe, when you've been in 3 years in Germany with them rough winters, it's easy to call Ocala beautiful, let me tell you.
Are you comparing?
Yeah, I'm comparing notes here. We got some things going on. We just want you to know about it before we get on with this wonderful show.
You got to tell everybody, though, don't forget to get their pencil and paper ready.
You get your pencil and paper
There
ready.
we go.
We got a lot of stuff coming up, okay?
You sure?
Yeah, we sure do.
Okay.
Vets Helping Vets is raffling off a beautiful rifle. It's a Ruger, very expensive now, 1022, okay? And it's got custom engraving on it. It's just beautiful. Now, people tell me that a rifle like this should hang on the wall. Of course, if I want it, I would have to shoot it. I mean, to me, a rifle hanging on the wall is no good. But it's beautiful. You can come see pictures of it at our office. Tickets are $10, okay? The raffle's going to take place on December 1st when we have our Christmas event. But you don't have to be there to win. So as long as you buy your ticket, if you win, you're going to get that rifle. Okay, as long as you're not a felon or anything like that. Of course,
You're sick. You're sick, Gary.
But come and get your tickets. Everybody knows where we are on East Silver Springs Boulevard there in the Veterans Resource Center. You can come in there and get your tickets, or you can call us at 352-433-2320. We got plenty of tickets, so come and see it. I'd like to be the one to sell it to you, but if I'm not there, you can get one from Hank or any of the other guys.
Right, you don't work off a commission on that.
No, we don't work off a commission.
No.
We just trying to earn some money here so we can take good care of veterans. We serve and save one veteran at a time.
That's
at
us.
Vets Helping
Yes.
Vets. That's what we do. And Brown & Brown is doing a 4th annual bowling event for the Marion County Veterans Helping Veterans. And that's going to be on Wednesday, September 27th. And it'll be from 5:30 to 7:30. It'll be at the Galaxy East Lanes on Maricamp Road. It's $300 per team, and there's 6 bowlers on each team. Now, you got to fill out a little bit of paperwork for us, so you can either contact Brown & Brown at 352, hope you got them pencils out, 387-4229, or we have some of these flyers and we have some of these applications, then you can come and get them from us at the Resource Center. Joe, you want to talk about the ice cream thing real quick?
No. You have it. I can't talk
I have it, okay.
It's in front of you. Talk about it. What?
Okay.
No, we got one each.
They want to hear your beautiful voice.
No. Ice cream and hot dog social coming up Sunday, September 10th, right here in the Ocala area, top of the World Town Square at Circle Square Commons. Bring a chair. It's Grandparents' Day. Food, fun, and entertainment. 1 scoop of ice cream, 2 1/4, a hot dog, drink, and a chips. $4.99. Why don't you just say $5? Come on. Okay.
Give that 5. You don't need your change back.
Yeah, right. Give just $5 bill. There's tickets on sale August 7th in the Recreation Center Ballroom, and it's benefiting. Guess what it's benefiting? Veterans Helping Veterans and Children's Backpack Program. So they're doing 50-50 either one. So it's good, and the Lions Club is involved with that. So it's a good thing, and it's community again. Community. Recognizing what is done here in the community, how everyone helps each other, and by golly, the veterans, and I clean that up because I'm on radio, the veterans in the area need their help as best as we can. When we come back from the break, we're going to visit 2 professional doctors here, thank goodness. They're professional, and they'll take care of you and answer your questions on the topic of the day. Larry, it's to you.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunshine mixing with clouds on this Thursday with an afternoon thunderstorm in the area, high 89 to 93. Partly cloudy Thursday night, low 74 to 78. On Friday, a mix of sun and clouds with a shower or thunderstorm around. Arriving in the afternoon at the coast, the high 89 to 93. Saturday, partly sunny with a stray afternoon thunderstorm, high 90 to 94. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Are you still looking for some color for your yard or garden? Well, it's not hard to find because there's plenty of color right now at Bob Wine's Camellia Gardens in Ocala. Bob's having a terrific closeout on Canna Lily in salmon, orange, or yellow, regularly $19.99 for just $7.99. Bob also has gorgeous yellow Alamanda, regularly $19.99 for just $12.99. And listen to this, daylilies are just $3.99. Plumbago blooming for only $2.99. White and yellow African iris, yours for just $4.99. Right now, today, take 20% off on all citrus trees, including orange, lemon, tangerine, lime, grapefruit, tangelo, and more. Yes, 20% off. Hey, watch for it. 65 years in the making. Coming to Bob Wine's Camellia Gardens in Ocala. Southeast 38th Street, daily till 4, Saturdays till 2, in the same blooming place since 1952.
Here's what you may have missed on the John Tesh Radio Show.
When we're stressed, we tend to take shallower breaths. If our brain isn't getting enough oxygen, it'll send signals to our body telling it to yawn deeply in order to get more air. Female Tinder users are 98% less likely to swipe right on your profile if your bio section is blank. Taking breaks does, in fact, help boost our mood and makes us more creative and productive.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
This is the beat of a normal heart. Now this is the beat of a heart of someone who just snorted or injected or smoked methamphetamine. Why? For a high. And this is what happens to that normal heartbeat. It's irregular, it's racing, it's why it's called speed, and it can do bizarre things to our heads. It can make us aggressive and violent. We can start hallucinating and end up doing some serious damage to people. Call 1-8888-NO-METH today for more information on methamphetamine. That's 1-8888-NO-METH.
A message from the Partnership for a Drug-Free Florida and America.
All right, 17 minutes after 9 o'clock, 81 degrees. Let's return now to Veterans News.
And we're back. Gary, throwing it over to you, then you can throw it over to them.
Yeah, I'm just going to...
Let go of that microphone. We don't want to hear creaking.
I'm just going to introduce Dr. Torres, and you can introduce your guest. He's with us with quite a few the past couple of shows, and he does a great job.
Thank you, Gary, Larry, and Joe, for having us here every third Thursday of the month. With me today is Dr. Howard Eskildsen, is one of the primary care providers of the clinic. The topic that we're going to discuss today is one topic, but it involves multiple different areas of the body, and we want to, as a primary care providers, we want to stress this, and is the cancer screening in different parts of the body for males and female patients. And the first question that triggered this is, what are the leading causes of cancer that we have? And starting with the number one is the lung cancer, because it's related to the smoking. The second one is the colorectal cancer related to polyps. And the third one is the breast cancer in women's. One note there, breast cancer is not only limited to females or ladies. It's men's or males can have breast cancer as well, and usually tend to be a little bit more aggressive than women's. And that's the reason why, is because of the amount of breast tissue. Women's has more breast tissue than men's, so cancer in men's of the breast can be more aggressive. And prostate cancer. Also, in women's, we do another screening, which is cervical or cervix cancer for our pap checkup, pap smear checkup. And the statistic is, what is the impact of these in the population? 48% of all cancer-related death. 280,000 deaths reported in 2013. Equivalent of one death every 2 minutes in the United States, and financially, time and quality of life and family and friends is it's hard for a lot of people. So issues, what are the principles in cancer screening? Condition must be high prevalence or major cause of death. It must be detectable at late in or early phases to have some workup and go and get the treatment immediately. Natural history must be adequately understood by both parts, provider and patient, and etiology, like the cause of it. Acceptable treatment available and facilities for treatment. We need to research. The doctor, the primary care doctor, will do the screening and then refer the patient to an oncologist, and the oncologist will determine the test that the patient needs more deep, and the treatment that is going to be dictated for that specific type of cancer.
Can I jump in with a question as we go along? Because I do have a question for you. When you started to talk about when the test is called.
Okay.
I call it a kaleidoscope. What do you? Colonoscopy. There we go. The kaleidoscope. Listen to me. They find polyps.
Yes.
Okay. And they're small, size of peas or smaller, I'm presuming. Mm-hmm. And then they snip them and they send them off, whether to find out if they're cancerous or not. Mm-hmm. 2 questions. Does everyone have them? Mm-hmm. And then the second question is, how are they formed? Why do we get them in that area all the time?
Yeah. The polyps, not everybody has them. In fact, most people don't have polyps, and there's 2 types of polyps. One's called adenomatous polyp, and adenomatous is a medical term that refers to glandular type of tissue. When you look at it under a microscope, it's got these beautiful little cells that are kind of purple and kind of form little cups or whatever, where they secrete stuff that goes wherever it's supposed to. And I loved histology, so it was really fun to look at through the microscope. And these are just new growths where the cells have started growing and multiplying on themselves in an abnormal way. It doesn't mean they're malignant to where they've lost control, but they have a potential for turning malignant over the next 10 years, 5 to 10 years or so.
So they're outside of, I'll call it the tube.
You've got the tube, the interior of the colon.
That's it.
And they're just little projections that project off like fingers or mushrooms. Now, some of them can be sessile, where they can be flat, like a big old ugly mole on, if I had a big old ugly mole on my forehead, they can be like that. But more often, the way they appear is just little lumps or growths on there. Now, looking at them through the scope, you can't tell which they are. There's another one called hyperplastic, which is normal tissue, just gotten a little thick. It's kind of like the skin on a bloodhound versus the skin on a terrier.
Okay.
It's just kind of lumped up, and they'll biopsy that, and if it's hyperplastic, well, that's just normal tissue that's not going to do anything, so you don't have to worry about that. But not everybody has polyps, and the polyps that are found, some of them can turn into cancer down the line, and some of them you just don't have to worry about. That's why it's always, the A word is the thing we look for, adenomatous. And if it's adenomatous polyps, you're going to need more frequent follow-up, whereas if it's a hyperplastic polyp, you just follow up at the regular screening rate.
When they, again, a layman's terms, when they go in to do the procedure.
Through the looking glass, you mean?
Yes, through the long looking glass, yes. When you're largely trained in this field, you know what to look for logically. Mm-hmm. When you snip them off for testing, how do you stop the bleeding? You have you cauterize in there as you snip.
You cauterize or bands.
Bands inside you.
They can do that, or mainly it's cauterization. They cauterize the area with like a little shock to stop the bleeding.
And that's it. Yeah.
That's what is important to verify if the patient is taking blood thinner, aspirin.
Sure, yeah.
Because then the doctor should prepare the patient days before, depending on the substance or the medication that you're taking,
to get off of it.
You need to stop this medication for a certain amount of period, and then you can have your colonoscopy. So the bleeding, it's not prolonged.
Right.
In case of the preparation for colonoscopy is not, okay, let's go ahead and do it, and you need to know the patient's medical conditions, you need to know the status of the patient, and biosocial, completely toxic habits and everything, medications.
Right,
and
makes sense.
then depending of the medical conditions the patient has. Like we have patients that they can have the colonoscopy in 2 different places. Like for instance, we do have colonoscopies done in Gainesville and the Villages.
Oh, okay. I think come about 2 different places. I only know one place you go in and do that. Okay, you
Sounds
mean
frightening.
Locations.
2 locations. So, and depending on the location is gonna be the Villages can take complex patients because they don't have a hospital. So if the patient has more comorbidities or more medical issues that can induce, because the anesthesia can cause other problems, that's when you need a specialty unit, and that's in Gainesville.
Okay, so the procedure can be done here. That's off 42, I think it is.
In 42, yes.
42, or in Gainesville, and your physician that you're visiting would know.
Yes.
Your personal physician would know
we
to send you either or.
We issue the consult. The primary care will determine if the patient is low, moderate, or high risk, and then depending on that, then that's where we send the patient to have the scope.
Wow, the scope.
And going back to the aspect of bleeding, if a person's on aspirin, they can usually go off of that. They'll ask about that, but generally you can go off of that a certain time. But there's one called Plavix, which is used as a platelet inhibitor. And if your person has had a coronary artery stent within the last year, we'll actually defer the colonoscopy because the danger of going off the Plavix and clotting that stent back up is greater than the danger of missing a polyp or picking up a polyp maybe 6 months later rather than just right at that time.
Oh, but it will be done, though.
That's
the
correct.
Procedure will be done.
That's correct. We just have to wait till that 1 year window after stenting is done where it's safe to come off the Plavix and it's unlikely that the stent will clot. Also, if a person is on warfarin, or similar type of anticoagulants, depending on the condition. Sometimes it's acceptable to stop that for 5 days to a week, but in other cases they may be very high risk of forming clots that they will actually stop the warfarin but use shots of what we call heparin. It's a fractionated heparin. They call that bridging. So they have it just right. That can be stopped very quickly. You do your procedure and then you can get the anticoagulation. So there's just only a very short time where you're totally anticoagulated. So there's lots of varieties of things that we do to prevent the bleeding.
You're saying it's within a 7-day window to stop, have the procedure, and go back on.
That's in general. Yeah. But with the bridging, you'd be stop at 7 days or 5 days, and then you'd be getting heparin shots. You'd be anticoagulated right up to the moment. They can reverse the anticoagulation. They can do the procedure and then get you back to anticoagulated state very quickly after the bleeding is under control and everything.
Doctors, we have a phone call, and we're about a minute and a half away from the break. So if you're listening and you're the caller, then it's possible that your answer will be after the break. But let's go to you straight away. Good morning. Thank you for calling. You're on the air.
Yes, thank you for taking my call. I had heard that if you had colonoscopies all your life and they were normal, no problems, and when you reach the age of 75, they suggest that you don't need to have that procedure done anymore. Can you enlighten me on that a little bit?
Yeah, that's one of those stories where the doctors can't make up their minds. Some people say at age 75 it is okay. Other people say that, well, maybe we should go to 80, 85, depending on which authority has reviewed the records. But generally, age 75, at that point you think, does a person have reasonably a 10-year life expectancy beyond that point? And if they do, it's probably worthwhile to continue.
Thank you.
All right.
You're welcome, sir. Thanks for calling.
Yeah, I you give it to me. I want it as long as I can live. Thank you very much.
Who dictates or recommend the guidelines for all the screenings is the USPSTF organism, which is
organization.
Yeah, organization, and it's.
Well, we're up to the break. We'll be right back.
All right, we'll be right back.
News
Radio, I'm Carol McHugh. Some tough talking tweets from the president aimed at those critical of the Charlottesville comments.
The president called out South Carolina Senator Lindsey Graham, describing him as publicity-seeking and accusing him of falsely stating that he said there's a moral equivalency between racists and the people like the mother of a young woman killed last weekend in Charlottesville.
Fox's Rachel Sutherland, the president also blasting the news media. In the push to remove Confederate monuments from public spaces across the South, some leaders concede the act will have little effect on race relations.
Governor Terry McAuliffe has changed his mind about the removal of the statues and is encouraging local governments and the state's General Assembly to take them down and put them in museums. Richmond Mayor LeVar Stoney has reversed his earlier position as well, saying the city will reconsider doing just that.
Removing monuments doesn't change race relations in our city.
Fox's Tanya J. Powers reporting. Fox News, we report, you decide.
Sometimes, what you want most from your car is nothing. No headaches, no surprises, no anxiety when it's late at night and you're on some distant freeway in a thunderstorm. That bit of nothing is everything. And that's what you get when you purchase a certified pre-owned Mercedes-Benz from your authorized dealer. Because only an authorized Mercedes-Benz dealership has the skilled technicians to certify that your pre-owned vehicle is up to Mercedes-Benz standards. Only Mercedes-Benz can back their certified pre-owned vehicles with an unlimited mileage warranty for up to 5 years, with roadside assistance included. It's time to experience confidence that's as unlimited as the warranty. Visit the Certified Pre-Owned Sales event now through August 31st, and you'll receive 2 years of prepaid maintenance and special financing available through Mercedes-Benz Financial Services, only at your authorized Mercedes-Benz dealer. You've waited long enough.
See your authorized Mercedes-Benz dealer for complete details and limitations on certified pre-owned warranties.
Ad Council.
Hi, I'm Seth with AA Lock, Dock, and Security. Have you ever thought about the locks or security on your house or business? Have you ever wondered why the keys to your new car cost so much? Well, at AA Lock, Dock, and Security, we can help with securing your valuables. We can even replace those expensive transponder keys. We can give you the knowledge that no one else will. Call AA Lock, Dock, and Security at 867-1965. That's 867-1965.
Hi, my name is Erica Olstein. I'm a doctor of acupuncture and oriental medicine. So, you used to be wired, now you're just tired. You used to be thin, but now you're the heaviest you've ever been. You don't necessarily always have to take a med if your thyroid is playing dead. If you have a thyroid disorder, an acupuncture visit may be in order. Come visit me, your primary care physician, Erica Olstein, at A Better You Healthcare. Call me at 352-615-5566.
This is James Snyder, inviting you to join me each Sunday morning at 9:30 for Sunday Joy on 1370 AM, 96.3 FM.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
I'm Jan Marino from Palm Garden of Ocala, and I'd like to tell you about the Palm Garden Way. We promote individual care, of course, but we also encourage GEMS. That's going the extra mile, and these are thoughtful individual gifts that make each guest stay special. A gem could be a daily latte or a new book or something else that means a lot to our guest. To find out more about the Palm Garden Way, take a tour, located on the corner of 27th Avenue and 34th Street in Ocala.
The entire world watched. They watched each step down the rungs of that small ladder, one after another, and waited with great anticipation for that last step.
It's one small step for man, one giant leap for mankind.
At that moment, humanity saw the impossible become the possible. And today, the sky is not the limit. Achievement. Pass it on. A message from the Foundation for a Better Life.
Put
Putting the local back into radio. 24 hours a day, 365 days a year. WOTA News. Variety. Information. Now. Keep your arms and legs on the inside at all times.
25 minutes before 10 o'clock, 82 degrees. Today is the third Thursday of the month, and every third Thursday we have a full hour of Veterans News, which means we've got a full 25 minutes left. And I would like to invite you to call if you have a question for Dr. Torres or Dr. Eskildsen. The number is 622-9622. I see some people looking online. You might be out of the area, so the area code is 352-622-9622. And, of course, Gary Pascale and Joe Martone in here also. Good morning, guys, again.
Good morning, Larry. Welcome back, everyone. And again, we have the doctors here, Gary, and I am tickled pink, yellow, and blue. They can hear you. The mics are on, gentlemen. They can hear you whispering over there, everybody. But we thank you greatly for what you do for all the veterans. You've chosen your professions of what you do, but you've chosen to work for the Veterans Administration. And from my heart, I thank you very much.
Well, we appreciate that very much, and we appreciate the opportunity.
Yes.
I can speak for me being a veteran, but I hope the rest of the veterans feel the same.
Well, we not only get care over there, we get compassionate care. And I think that's what makes the big difference between the VA healthcare system and a lot of the civilian doctors, that I've been to.
Mm-hmm. Thank you.
And don't get big heads now.
Right. All right. So talking about colon cancer, we're gonna ask Dr. E what age ranges benefit from the screening.
Cool.
And it's based on age, based on risk. And part of the qualities of the test are being able to find something that can be corrected, but also the value of the test depends on what's the incidence of disease in the population. In other words, if you're doing a test in general, we could test everybody, but there'd be a whole subset of population would get no benefit whatsoever from it. So what we're trying to do is narrow it down to the population that's most likely to benefit, so we get the most good out of the testing procedure for the cost that's involved. And basically, generally, we talk about screening at age 50 if there's no additional risk factors. In the black population, there actually is an increased risk, and so we recommend starting perhaps at age 45. Because of hereditary risk, we really don't know why that is, but that's just one of the recommendations. If there's been a family history of colon cancer, then we'd consider starting earlier, especially if that was somebody younger than age 65, a first-degree relative, or if you had two first-degree relatives of any age that had colon cancer, that's when we'd want to start. The screening would probably be earlier. Generally, we'd start like about 40, but if you had a first-degree relative with colon cancer that was, say, in their, 45, you'd probably want to start screening 10 years earlier than that. So it's variable for the high risk, but generally be 45 to 50 be the time for general screening. Now, on the other hand, if on examination you find other abnormalities, say the blood count is low or there's something makes you think there's some blood loss, then we do some other tests that sometimes will lead to colonoscopy at a different stage than that.
Can a person request a screening?
That's a qualified yes, generally, but if you had a 20-year-old come in and request a screening for this consult to be accepted, I would have to build a strong case. What other risk factors do you have?
Right. Logically, they wouldn't just come off. Yeah, I want to screen it because I heard. But if they would show that it was a family.
And especially if there's a family history. But generally, generally people can get a colonoscopy at their request. In fact, I'm very happy when they request because sometimes that brings something to the table I didn't realize was there. Oh, well, I had two family members who had colon polyps, or had this. Well, somehow that wasn't discovered in the prior discussion.
Right.
There's a condition called familial polypomatosis that is the patient has multiple polyps in the colon and pass through generations, and sometimes people need to go through surgery because they have so much polyps in there that the colon need to come out. How much? That's going to depend on how extent and how bad is the quantity of polyps in the colon. So the surgeon will determine how much colon goes away.
Now, the big question I have for both you gentlemen, polyps can be non-cancerous.
Yes.
They form. What causes them to have them in some people, cancerous or non-cancerous, and some people don't have them? Is there a dietary thing? Is it hereditary? Is it who you are? Or I know this is kind of hard.
That's a multifactorial question. There is certainly a familial tendency. Mm-hmm. And there are some genetic defects which can cause that, but the genetic defects aren't as common. I'm sure there probably is in the people in general population to get the polyps, but there's a subset of genetic defects we definitely look for, which was mentioned by Dr. Torres, and there's some other genetic factors. But most of them, we don't clearly understand why, but there is a family tendency. So clearly, some of it's in the genes. There is some concern that maybe eating high-fat foods may aggravate it a little bit. It's not the only cause, but it may aggravate it a little bit. Foods that are flame-broiled, that sort of thing, may aggravate it. There are certain things. There's been debate on whether low-dose aspirin might prevent it. Mm-hmm. More studies you do, the more confusing it gets. And some studies you suggest it might make it worse. And the main conclusion of most studies is that there need to be more studies. It can be very confusing.
But it's just more screening. Go, Gary.
Most of the people that get colon cancer, develop colon cancer, are they people that have never had colonoscopies?
That's hard for me to say. In the past, back in the early days when I was in practice, that was definitely true. Now at this time, we're picking up so many with the colonoscopies and the different things that are done that I suspect a lot of them are picked up on colonoscopy and so gotten at an early age, but I don't have the statistics exactly on what's the deal on that. And I've seen it as early as in people in their 40s, coming in for strange abdominal pain. We get a CAT scan and say, oh my, look what we found.
Those blood tests, because we all go in. I just did 4 vials of blood were just taken from me last week for my upcoming physical. Mm-hmm. Does that give you flags, red flags, saying, "Oh, this is abnormal. Something's happening somewhere else in your body"?
Usually, the test that we prefer and more precise actually is called FIT test. It's a DNA test that specific detects the DNA coming out from the red blood cells and tissue that is from the colon, and can tell if there's presence of blood, means that something is not doing good in the intestine and should be scoped or checked to see if that is from a polyp or something else.
Now, that is from the blood taken from your arm. You can see this.
No, that's from your stool.
Oh, okay.
Yeah, we only have indirect blood tests that may give us a hint because there's not a specific blood test that's good for telling that. Now, I have just recently read something in what they call Science News, which is a really great little paper that summarizes the current science status about somewhere down the line we're hoping to have chemical colonoscopy, so to speak, or chemical testing where they can perfect detecting DNA from cancer cells in the blood. This is in very preliminary stages. There's some specific areas where it might provide some hope. It's probably going to be 10, 15 years before any of this might even be applicable. Mm-hmm. But there is some hope down the line of some kind of test. But what we'll find on a blood test and our screening test, so sometimes will alert us to something going on in the colon, is a drop in hemoglobin and hematocrit. Mm-hmm. If you get a significant drop, equivalent to, say, about 1 unit of blood, okay, the alarms go off. We've got to find out what's the iron levels, what's going on, and we do the FIT test, and then we do a colonoscopy. Because in people our age group, the older adult age group is what I'm referring to. I guess I shouldn't say our age group. Well, they can
see you also, but yeah.
And it's
now
almost...
you're saying older. You're saying 50, 60, older when you say older.
70 or 80. No, I'm kidding. I'm in that age group.
Older than dirt, there is.
I'm in an age group that they now classify as between 65 and death. Okay, I won't go any farther with that.
I call you seasoned.
Yes, there you go. But we go in and we check to see if there's something going on, because almost always the cause of that is some sort of bleeding from the digestive system, either from ulcers, something esophagus, or else from a polyp that's going on, or sometimes from diverticuli. But that's a clue, and we go check that, and they will be getting upper and lower GIs to find out what's happening.
Okay, we have about 20 more seconds before we hit the break at the quarter of the hour. It's amazing how this time flies. When we come back, we'll talk more about other beside the colon cancers, other cancers, the cancer of the eye, and so forth, that is there for everyone. And we'll be right back to you.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunshine mixing with clouds on this Thursday with an afternoon thunderstorm in the area, high 89 to 93. Partly cloudy Thursday night, low 74 to 78. On Friday, a mix of sun and clouds with a shower or thunderstorm around. Arriving in the afternoon at the coast, the high 89 to 93. Saturday, partly sunny with a stray afternoon thunderstorm, high 90 to 94. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
Keep up with what's going on in the downtown area with Ocala Downtown Newspaper. Delivering thousands of newspapers to businesses in the downtown area, Ocala Downtown is there to keep you informed. They even have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company that fits your needs, and all we ask in return is that you tell them where you heard about it. It's simple. For more info, just call Tom's Picks, 352-804-1223, and pick up your copy of the Downtown Ocala newspaper today.
Now read Ocala Downtown newspaper online.
An unexpected pregnancy can turn a young woman's life upside down. The House of One in Faith in Ocala gives these young women a place to live in privacy and comfort under the Christian care of counselors who will guide and protect both the woman and her unborn child. The House of One in Faith is confidential, loving, and free. For more information, call 352-687-8895.
In Grace, 1943, the Grace family lives in Miami, Florida during World War II. The book is historical fantasy. The history is real, but the characters have special powers called graces. And it's the first in a series. Fact meets fiction in Grace, 1943, a fascinating book filled with adventure and humor by Courtney Williamson Milford. Now available in print and as ebook on Amazon.com. Listen in August 23rd at 9:05 during AM Ocala Live to this fabulous author.
Hi, this is Simon Amir, DMD with Grand Oaks Dental Care. Join me this coming Friday at 11 a.m. when I will be live in studio to talk about how you can achieve optimal dental health. If you've ever wondered how to break the cycle of constant cavities or what can be done to restore your smile, this is your chance to call in and chat with me, Simon Amir from Grand Oaks Dental Care, live this Friday at 11 a.m. right here on WOCA, The Source.
All right, 12 minutes before 10 o'clock, 82 degrees. Temperatures are expected to reach 91 today. Let's return to Veterans News.
We understand you two gentlemen, two doctors, are going a little different vein while we're on the air listening to the many great sponsors that we have. Go for it, gentlemen.
We're not going that far in the body. We're going to talk about prostate cancer now.
Okay.
So, Dr. E, should you be screened for prostate cancer? Or who should be screened for prostate cancer?
Oh, I thought he was asking if I should be screened for prostate cancer. And I thought, well, I can't give that personal information.
The seasoned one, yes.
Yeah, well, back in the old days when I was getting started, yes, there was a solid answer on that. And that was actually before PSAs, and we would do the digital rectal exam was a screen that was done for that. And then once the PSA came on board, well, we've got a test that if the prostate cancer is present, usually it'll push up the PSA, and that'll be a clue.
And the blood sample.
Blood test, yes, that's a prostate-specific antigen done out of your arm from the blood test.
Okay.
In addition to the other one. And between the PSA and the digital rectal exam, we felt that we finally had a screening to find a problem that we could really get our finger on, if you'll pardon the pun. But this, we came to find out, well, first off, you find cancer, that's really great. You get it taken care of. You treat it, and that's really a good thing, isn't it? Well, that's the logic. The studies start saying, well, I'm not so sure, because even though we were finding more cancers at an earlier stage, we're not finding an increase in survival. associated with finding them early, which means prostate cancer is several different beasts, so to speak. And the older I get, the less I worry about prostate cancer, because if and when I do get it, it's probably going to be less aggressive than, say, if I'd gotten it when I was in my late 40s or 50s.
Why?
That's a good question. But it just generally tends to be much more aggressive in younger individuals. So that's the concern we have on that. And if you get people in their 80s and 90s that if they have an autopsy because they died for whatever reason, they'll incidentally find prostate cancer in 40-50% of the people if they happen to check that during the autopsy. And it's a very benign, mild, not benign, but a very mild, non-aggressive type, which is hard to explain.
You know, it's just sitting there idling. Like a car, it's idling but not put in gear.
Yeah, it's not multiplying rapidly and spreading to different places, to the bone and wherever, and causing trouble. And so we're finding a lot more what we call indolent cancers. Okay, we've got a phone call?
I didn't mean to stop you. Yeah, that's just when you're ready to take a breath.
Okay, I'm ready to take a breath.
And by the way, the phone line is open. I'll take this opportunity to give out the phone number again. It's 352-622-9622. And good morning. Thank you for waiting and for calling. You're on the air.
Thank you very much, and thank you for this wonderful program. The question now on prostate cancer is, I had heard that if in most cases of early prostate cancer, radiation treatment is as successful as surgery. Is that true?
It's an acceptable treatment, and it certainly is a good option. And it's hard to say which treatment is better. If there's any sort of indication of spread, the radiation might be the preferred. Surgery supposedly will take it out, but if there's extension beyond that, it can still recur. There's complications with surgery and with radiation involving, there can be loss of bladder control, there can be problems with prolonged bleeding, there can be decreased sexual function that can go along with that. So it's hard to recommend one against the other, and you have to take into consideration what's the general condition of the person with the prostate cancer, and what are their preferences. Pardon me. Yeah. What are their preferences as well?
Wouldn't it be with radiation less complications rather than surgery?
It's getting better with the complications with radiation, but with radiation, you do still injure some normal tissue, and so you may have trouble with prolonged diarrhea afterwards, sometimes even some bleeding periodically after that. Sometimes there can be some bladder control issues with that. And yes, it would seem like with the radiation you have fewer complications. However, they're getting better at targeting just the cells, so over time that might become the preferred route, but it's hard to say.
Thank you very much.
Thank you for calling, sir.
More to chew on, as they say.
Doctor, when you say PSA, I know, like when I look at my lab test, I know that's of the prostate, but what does that actually stand for, PSA?
It's a type of protein called prostate-specific antigen, because most of that type of protein is produced in the prostate and gets into the bloodstream. As the prostate gets bigger, there is more PSA, so as we age, our PSA will slowly go up. If there's a growth, that will, like a tumor getting started, that will elevate the PSA. If there's an infection, that will elevate the PSA just a little bit too. So, but it's from prostate. There are some other areas that produce similar antigens, so it's measuring the stuff in the blood is not, it can be difficult because there's a lot of mimics there, but they're getting better and better at fractionating that out too for the PSA.
When we perform a PSA and you have an elevated PSA reading, usually the doctor should order or is going to order to repeat the test around 1 or 2 weeks to make the difference between one thing and the other, plus a urinalysis. If you see a combination of an abnormal urinalysis and elevated prostate, that's prostatitis, probably secondary to an infection, and then the doctor will proceed to give you antibiotics for 7 to 14 days. And then retest you again with a urinalysis and another PSA to see if the numbers comes down. If you have a normal urinalysis, no symptoms of a urinary tract infections, your PSA is more than 4, which is the upper limit in the test. The doctor should repeat that within 7 to 14 days. Again, in a blood test, and see if the PSA is still high. If the PSA is higher, then it's recommended for the patient to go to see a neurologist. And the urologist will go more in deep about possible doing a biopsy of the prostate and go more deeper, take some tissue out, send it to the pathology lab.
And finding out if you have it or not.
Have it or not, yes.
And if you don't have it, then the test is showing something else because you had the elevation.
Yes, some patients. I have patients that they have elevated PSAs, and they have had biopsies multiple times, and they just have chronic inflammation. But you never know.
Better be safe than sorry.
Yes.
And now, when you're saying take samples and all, taking samples and all, is that an invasive procedure or?
It's basically done transrectally, so they open the opening a little bit,
right,
and then put a needle in there, and then guide the needle into where they think the biggest concern is.
Yeah.
Or they'll, if it's not a specific, if there's a lesion, they'll target the lesion. If there's nothing, then they'll try and do a four quadrant biopsy where they get the full prostate, and that can be. I've heard the procedure described anywhere from a mosquito bite in a strange place to a very painful and uncomfortable procedure, and all in between. And my guess is the more painful is probably because the needle got just to the edge and a little bit beyond the prostate tissue, which is hard to tell. Sometimes they'll do ultrasound-guided biopsies too.
And the patient's asleep now, I'm presuming.
Not necessarily, no. Not necessarily.
But the patient can choose to go to sleep for that period of time? Is it a patient's choice? In other words,
most of the time they do it without putting a person to sleep.
But if they requested it?
I would imagine, but I can't say for sure on that.
No happy medicine either?
No. When I had my
Okay,
I'm going to confide in some personal information here, voluntarily. When I had my prostate biopsy, it was, hi, bend over. And frankly, it didn't hurt very much at all, but I was lucky. Yes. Some people, it hurts quite a bit.
Okay.
And you just never know if you're going to be the one that's lucky or the one that's not.
Right.
Depending on who
Good.
and where they're
have it done. Okay, let's take care of that. All right. If it wasn't for bad luck, I have no luck at all. I'd be bending over and go, okay, that's enough of that. Oh, my goodness.
Well, we don't want to do a half-hearted job, you know.
Whoa, I'm glad you cleaned that up. Half-hearted, get it? We won't go there.
You know, them doctors go, when they did my pacemaker, they didn't put me to sleep, but whatever they gave me, I watched it, you know, and didn't feel, and didn't know and didn't care. And, you know, so, you know, y'all do a good job when you do that.
That's you, Gary. Yeah, we know that. Yeah, we know.
Well, infantry soldier, so I guess I'm tough.
Oh. We've got about a 2-minute window right now before the program ends. Believe it or not, that's how fast it goes with this. You know, this is just a tip of the iceberg.
Yeah.
If you're a veteran, talk to your physician logically. Then your physician will take it the next step. The main thing I've gotten from both you gentlemen today is screening. Don't be shy. We're all human beings. Doggone it. Let's just get it done. And prevention.
And it's worthwhile discussing your concerns, because there's some people we might not necessarily screen particular prostate cancer based on guidelines who are concerned. For me, that's a legitimate reason to do a screening. If a person say, I will sleep better at night if I get this checked out. So it's really important talking with your patients. I remember one of the best doctors I ever worked with in residency, he said, talk to your patients. They'll tell you what's wrong with them.
Mm-hmm.
Yeah,
that's correct.
The communication. Go ahead.
I just want to finalize and now let the veterans know, and all the listeners, that we are located in 1515 East Silver Springs Boulevard, Suite 226. Phone number is 352-369-3320. If you have any questions about enrollment, or if you have any questions about when you see your provider, just give us a call. If you're established in the clinic, just talk to your PAC team, your nurse, and if you're not enrolled, just come and visit us, and we're going to be more than welcome to receive you.
That's it. If you didn't get all those numbers, don't worry. We have them here at the studio. Remember, 433-2320 is the number for Veterans Helping Veterans. They can give you all the numbers. They can make the connection for you if you're shy. Again, 433-2320. 2320. We have about 40 seconds to go, Gary. It's all yours. Wrap it up, please.
In that 40 seconds, don't forget that same number. You can get those raffle tickets. And, we want to give our thanks to the great staff at Ocala Seebach for the care that you give us. And thank you for coming on here with us every month and telling us about these good things. And for Hank Whittier, I just want to say, God bless America.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Out west, and that announcement has disappointed Phoenix Mayor Greg Stanton.
I'm disappointed that President Trump